a care facility. The first thing to be wary of is if you're asked to book an appointment. Why is this? Is this for your convenience or for their convenience? A care facility should run at the same high standard regardless of whether you're visiting or not. Also, ask to see the latest inspection report and statement of purpose. By examining the inspection report, you can see where weaknesses within the facility have been picked up, and therefore you can question these with the manager and see what's been done to counteract them in the meantime. Look at the staff to resident ratio within the facility, both during the day and during the evening and the night times, and also the level of dependency of those residents. If it's a much higher level of dependency, then equally there should be a better higher to resident ratio of staff. Ask about the training procedures that are in place for staff. Staff are the most valuable commodity within a care facility, and they should be looked after as well as the residents. Do they do NVQs or City and Guild certification? Have they got the ability to advance within that care facility? The answer should always be yes. Also, what percentage of agency staff are employed? One of the worst things for a resident can be waking up every day seeing a face that is alien to you. They need to be comfortable with those people looking after them. If there's a high number of agency staff or a high staff turnover within that care facility, do be wary and ask the question why. What languages are spoken in the facility? Increasingly, residents are very diverse, and you need to know that if that's the case with your relative or friend, can they be catered for? Also, be aware when you're doing a tour of that facility. How do the staff interact with the residents? If English is not the first language of the staff, are they talking to the residents in their first language or each other in their own language? Again, it's all about communication. What payment system operates within the facility? Are you charged extra for things like hairdressing and chiropody? This is standard, but also make sure that other things are included, such as cleaning, such as laundry. If you're not sure about this, do ask, because these costs can add up. What are the complaints procedures within the facility? If it's owned by one person, what do you do if you have a complaint against them? That's very important. You need to be comfortable that there is a clear procedure in place. Equally, if it's a corporate-owned company, is there a procedure there that you can go above the head of the facility manager to maybe a regional director or somebody of that ilk? Can you see a copy of the activities programme? Activities are incredibly important within a facility environment. People need to be stimulated. If you can see a copy of the activities programme, can you see activities going on? Equally important. Don't just take what you see on a piece of paper for granted. Make sure these activities are taking place within the facility. What links has the facility forged with the local community? Do local groups come in and work with the residents? Equally, can the residents go out and work with groups within the community? Again, it's about making sure this is a resident's home and that their life continues as much as possible as normal. Are residents allowed to bring items of their own furniture into the home? The answer to this, again, should always be yes. This is their home. This doesn't mean it has to be a 10-foot by 6-foot wardrobe, but maybe trinkets, lamps, little chests of drawers, things like that, which make a room into somebody's home. Are pets allowed to come and visit or stay? Maybe not necessarily 2 Great Danes, but a bird in a bird cage or some fish. Do be aware, however, that the responsibility for these can never lie with that facility. If you decide you want to take pets in to see a resident, the responsibility for those pets lies with you. How flexible are meal times within the facility? Care should always be person-centred. That means it shouldn't be about regimens, it should be about that person. If your relative or friend decides that they want to stay in bed one day until 10 o'clock, is that a problem? Or do they have to be at breakfast at 8? Again, who is at the centre here? It should be the resident. Are there organised trips out and about to the theatre or to local tourist attractions, for example? Again, the answer should be yes. Don't take the excuse that the facility doesn't have its own transport. You can always hire a minibus. Are there specific visiting times for friends and relatives? The answer to this should be no. After all, this is that resident's home, and people should be able to come and go as they please, at their convenience. A very important question to ask a care facility manager or owner is what makes their facility different to others? If they haven't got an answer for you, you've just been given your answer, because they should take pride in the fact that what they deliver is a quality service that you won't find anywhere else. Equally, is there a trial period on either side? So if your relative moves in, is there 3 to 6 months during which time they can choose to move out, or indeed the facility can choose to move them out if they think they're unsuitable? This isn't necessarily a bad thing, as it gives you both flexibility. Finally, ask the question of the care facility manager or owner, why should you choose their facility? Again, they should have an answer for you. If they don't, you've just been given your answer. We hope that these series of questions will help you in choosing the right facility for your relative or friend. If you have any questions, please do not hesitate to contact us at the website enquiries@whereforcare.co.uk or enquiries@whereforcare.com if you're looking for a facility in the US. Thank you.